Hi friends, welcome to Ayursure. Myself Dr. Saurabh Naik, and today we are going to discuss Eular ACR criteria for rheumatoid arthritis. First of all, let us know the importance and use of diagnostic criteria in rheumatoid arthritis. We all know rheumatoid arthritis is a chronic, systemic and autoimmune disease. There is a great advance in understanding the disease process, diagnosis and treatment in the last 2 decades. It has a varied clinical pattern. Every affected individual may not have the same symptoms or severity. There is no single dependable confirmatory diagnostic test based on which we can say whether a person is suffering from rheumatoid arthritis or not. Hence, there is a great need for a uniform and standard criteria for the diagnosis of rheumatoid arthritis by the clinicians. The present criteria is brought to you by joint efforts of both Eular and ACR. Eular means European League Against Rheumatism. ACR means American College of Rheumatology. The 1987 ARA criteria, that is American Rheumatism Association criteria for diagnosis of rheumatoid arthritis, failed to diagnose early cases of rheumatoid arthritis, which means the old criteria was very effective in the diagnosis of established cases of rheumatoid arthritis, but it was not so effective in the diagnosis of early cases where typical signs and symptoms were not present. Hence, the present ACR Eular criteria 2010 replaced the old one. There is a high level of consensus between ACR and Eular in developing the 2010 criteria. The 2010 ACR Eular criteria is more stringent in diagnosing early conditions of rheumatoid arthritis so that early interventions can be made and joint destruction can be prevented. Now, let us learn the different components of ACR Eular criteria 2010. Broadly, it has got 4 components. Number 1, joint symptoms. Number 2, serology, which includes rheumatoid factor and ACPA. Number 3, acute phase reactants, which includes CRP and ESR. Number 4, symptom duration, whether less than 6 weeks or more than 6 weeks. Now, let us discuss the 2010 ACR Eular criteria in a little details. So this criteria is based on a scoring system. सबसे पहले बात करते हैं joint involvement की. If only one large joint is involved, the score will be 0. If 2 to 10 large joints are involved, the score will be 1. If 1 to 3 small joints are involved, it will be 2. If 4 to 10 small joints are involved, the score will be 3. And if more than 10 joints are involved, including at least one small joint, the score will be 5. अब बात करते हैं सेरोलॉजी की. सेरोलॉजी में हमारे पास 2 पैरामीटर हैं, rheumatoid factor and ACPA. Negative rheumatoid factor and negative ACPA, the score will be 0. Low positive rheumatoid factor or low positive ACPA, the score will be 2. High positive rheumatoid factor or high positive ACPA, the score will be 3. यहाँ पे high positive का मतलब होता है the value must be more than 3 times the upper limit of the normal value. अब बात करते हैं acute phase reaction. यहाँ पे भी हमारे पास 2 पैरामीटर्स हैं, CRP and ESR. Normal CRP and normal ESR, the score will be 0. Abnormal CRP or abnormal ESR, the score will be 1. Last but not the least, duration of symptoms. If the symptoms are less than 6 weeks duration, the score will be 0. And if the symptoms are more than 6 weeks duration, the score will be 1. For a definite diagnosis of rheumatoid arthritis, it requires a total score of at least 6 or more out of 10. Times and again, we get multiple choice question out of this ACR Eular 2010 criteria during various competitive examinations. So now let us solve a sample multiple choice question. Which of the following test is not included in ACR Eular 2010 criteria? Option A, CRP. Option B, ESR. Option C, ACPA. Option D, ASO. By this time, we all know CRP is very much included, ESR is very much included, ACPA is very much included in the ACR Eular 2010 criteria. But the test that has got no mention in the criteria is ASO. Hence, the answer should be option D, ASO. Please remember, the following conditions are not included in the ACR Eular 2010 criteria. ये ACR Eular 2010 criteria में included नहीं है. Number 1, symmetry of joint involvement. Number 2, duration of morning stiffness. Number 3, presence of rheumatoid nodules. Number 4, radiological evidence. Number 5, structural damage to the joints. ये 5 कंडीशन ऐसे हैं जो एसीआर यूलर 2010 क्राइटेरिया में सम्मिलित नहीं है, इंक्लूडेड नहीं है. थैंक यू.